Now, 1 in 5 people in our country are living with obesity, and more than a third of Texans are affected. Those are new numbers, too. Those are the latest stats from the CDC. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining me live this morning. Dr. Persse, what's the importance of these new obesity rates?
Yeah, good morning. And this is a really important thing because it impacts your health in so many ways. So, a regular person who, I mean an adult who is overweight runs the risk of bringing on, imagine that you've got all this extra, weight on your body. Your heart doesn't get a whole lot bigger. It still has to pump. So you've got to pump blood to a whole lot more of you than it did before. So that puts a strain on your heart. Mm-hmm. You're going to get high blood pressure as a result. That can lead on to stroke and more heart disease. The other thing is that when you have a diet that makes you obese, there's generally a lot of sugar in it. So that sugar goes up. Your pancreas responds by putting a bunch of insulin out. And over years, your body responds less well to that insulin. That's called type 2 diabetes. That results in higher sugar levels in your blood. And guess what? That damages the blood vessels, and that goes back, causes more hypertension, causes more heart disease, and it becomes this cycle of one problem building upon the other. The other thing that people don't often think about is that this puts a lot of strain on your liver, your gallbladder, your intestinal system. Like I said, your heart doesn't get a whole lot bigger. Your lungs don't get any bigger either. Now your lungs have to breathe for a whole lot more of you. And then in addition, now that you're carrying all that extra weight, that puts strain on your ankles, your knees, your hips, and now you're going to get arthritis as well. That's going to make it more difficult for you to exercise. So these things, they roll and steamroll upon one another, and it becomes a real issue. And then if we look at it from a society standpoint, as you pointed out, over a third of Texans are obese at this point. That puts a strain on the healthcare system. It fills up the doctor's offices, fills up the clinics, fills up the hospitals with people who had a healthier weight. They wouldn't be using all that, and so it would be easier for us to get in when we needed to. But we all know it takes weeks to get a doctor's appointment, and you can wait hours in the waiting room of the emergency department right now.
Yeah, that's true. And we all know also about diet. We know that we should be eating more vegetables and lean protein, fewer calories, fewer carbs. But then exercise, as you mentioned, can be a challenge for people because they've got joint pain, knee pain, things like that. So talk about how important is it to exercise, and what do you do? What do you suggest that people do even in this heat? How can they best exercise for their weight?
Yeah, so the first thing you said is you talked about the diet, and I want to remind folks that when it comes to weight management, you really need to put about 80% of your planning, I should say, into the diet itself, and about 20% into exercise. And the key thing about that is that if you exercise like crazy, but you're still eating badly, you're never going to catch up. So you got to do both. You can't just let exercise overcome your diet issues. And so, we live in a world, we got all these high processed foods and lots of sugar in them that makes it difficult. The other thing is the screen time that keeps you from exercising. But when it comes to exercise, there's so many things that you can do. So the U.S. Department of Health and Human Services suggests that for the average adult, you only need about 2.5 hours of moderate physical activity a week. So what is moderate physical activity? So that's a brisk walk, maybe playing tennis, yoga, some water aerobics. If you don't have 2.5 hours, you can get by with 1 hour and 15 minutes, according to the Department of Health and Human Services. But that's a vigorous activity. So this is, running, jogging, jumping rope, riding a bike, but doing it faster than 10 miles an hour, definitely more intense. And that's just the aerobic part. In addition, and don't forget this is important, you need at least 2 days of exercising to strengthen muscles. So this is going to be some sort of weightlifting or resistance training. And that's really important that you get both of those. Yeah. It's not a lot of hours, but you got to do it.
Yeah, strength training with heavy weights. Dr. Persse, when should we get our doctors involved in this? Because I know a lot of people who do everything right, and then there's still things like genetics working against them, chronic conditions working against them. So when do we talk to a PCP, an endocrinologist, an obesity specialist about having trouble losing weight?
So certainly if you've tried the things that we just talked about and you're not getting ahead, then you need to start talking to your doctor, because a lot of it, like I said, a lot of it has to do with diet. But as you point out, there are some folks that even with diet, because their metabolism is not exactly where it needs to be, and this can be for a variety of reasons. There can be hormonal reasons. There can be the type 2 diabetes that you don't know that you have. There can be other underlying diagnoses that are preventing you from getting ahead, and you need to talk to your doctor, number one, to identify them, number two, to manage them, and then start getting ahead on these things. So, if you really watch the diet, and I can't stress that enough, and you've got your diet under control and you're not eating other sugary things and you're exercising, you're not gaining any ground on this, that's when you need to go to talk to your doctor and figure out what it is that's blocking you from achieving.
All right, Dr. David Persse, we've run out of time this morning, but quickly, if you'd like to tell people what they can do instead of going outside in this heat, how can we best exercise?
Yeah, so there's a lot of things you can do indoors. You can have some weights in your office,
Yeah,
maybe some
nice.
resistance bands, right? And there's lots of things you can do using your own weights, squats, push-ups, pull-ups if you got a pull-up bar. There are things you can, there are chair exercises. Search the web. There are chair exercises that you can do.
Yeah.
Anything, there's all kinds of things you can do. Your own body weight is a great source of weight if you can't get to the gym or if you don't have some weights in your home. So all kinds of things you do.
Nice.
The internet's a great source for that.
Body weight counts. Thank you so much, Dr. Persse. We always appreciate having you.
Thank you, Haley.